The pandemic has wiped out many of the gains the province has made in recent years to reduce surgery wait times. The BC government says they're now embarking on an ambitious plan, and it'll resume in a way that's dramatically different.
It was, in some respects, easy to shut that down. It's easy to say no in a system. Much harder to get going again because we have cases continuing into the system. We have to assess patients for the urgency of the surgery. It's an enormous challenge. And because we have people on a wait list already, and this simply adds to that and presents a real challenge for the system.
Here are some of the biggest challenges with relaunching the system. The province will have to immediately ramp up surgery capacity by extending operating hours and mobilizing more private clinics. That means new funding is needed, $250 million in the next year alone. The bulk of that will go towards recruiting more personnel. BC is looking to hire hundreds more nurses, surgeons, and anesthesiologists. And it's all coming on an ambitious timeline, 17 to 24 months to clear the backlog, and that's if there are no setbacks like a potential second wave of the pandemic. Despite all that, Premier John Horgan says it was without a doubt worth it to have our healthcare system positioned to handle a possible surge in COVID-19 cases.
Absolutely the right thing to do, but we need to put into a context that today is the day after we announced our slow and focused restart plan, and the first order of business is to say to those who made a significant sacrifice by having their surgeries canceled that they're at the top of the priority list for us going forward.
Here are the new protocols for how patients will get back into the system. First up will be priority patients, anyone with a wait time less than 4 weeks. They'll receive a call anytime now to confirm they're ready and willing to go. Then they'll be pre-screened over the phone 24 to 72 hours before surgery. They'll also receive a day of assessment when they arrive, and then medical teams will allocate personal protective equipment as needed for each surgery. Now, even as all these scheduled surgeries were halted, 17,000 emergency surgeries have still been completed in recent weeks. Tanya Fletcher, CBC News, Vancouver.